It's just bad stuff. It's just attacks again and again and again. Why can't they just leave us alone? Hi there, welcome to the first video of mine in quite a while. I had a few videos planned ages ago, a good week or maybe 2 weeks is coming up to since I've actually recorded a video, because I had a few sort of just ready to go for a few days. So yeah, apologies for that. What happened was I lost my voice, and I lost my voice, so I wasn't able to do any YouTube videos, so I had to recover for 1 week. And most of this week I've been in the office for work, so I've not been able to do any recording either, or even making thumbnails or anything like that. I've just been really busy this week. But I wanted to get back on the horse, start doing more videos, and hopefully do them. I wouldn't be able to guarantee that I could do them daily, because that was something I was really just experimenting with to see how far I could get. But we'll try and set something up. We'll try and arrange an actual schedule. And today, what I wanted to talk about was puberty blockers in the UK. So this is something that we've talked about a couple of times now in the last two videos, really. So the last one with the Crick kids there, of Trans Kids Deserve Better, who are fighting for their rights to be able to access puberty blockers like any other trans youths in the world, really. Any other European country, and in the States, I think for now, there, and hopefully it gets better there rather than worse. So so it's hard to start, really. It's hard to lead into. Puberty blockers have been banned in the UK, and it's something that's been on temporary ban or continued temporary ban since Labour got in, when originally it was an emergency ban through the Tories, so that more research could be done. But no, through the Health Secretary, Wes Streeting, the ban on puberty blockers has now been made permanent, unless you are a trans youth who's taking part of research for puberty blockers and their safety. At the time of recording this video, there's not been revealed publicly any plans to have studies into puberty blockers to prove if they are helpful or not. We already know from loads of international studies that puberty blockers do help trans and gender questioning people, because again, it's completely reversible. It gives people the choice to stop taking a puberty blocker and for their natal puberty to resume if they realise they're not trans, or if they're maybe non-binary and they're okay with their puberty resuming, for example. And I'll tell you what, not a lot of people that are questioning do turn out to be cisgender, so they would continue to go from puberty blockers to cross-sex hormones. And that's the thing, puberty blockers, regardless of the outcome there, if someone is in fact trans or not, it leads in them being stopped being taken, and the effects of them, the cessation of the puberty, being reversed, because you either go through a puberty caused through hormonal gender transition with cross-sex hormones, or you just go through your natal puberty. So there's really no risk from there. Well, there are risks, there are side effects there from any medication, but there's no inherent danger, really, that really should have caused there to have been an emergency ban and now this permanent ban. Really, it all comes down to what's called the CAS review, which was conducted, I think, in April of this year, where no new data was made. It was an analysis of many different studies, 50 studies in total were picked up and mentioned, and then about 25 of them were immediately just thrown away for arguments that the methodology of them wasn't clear. So there's no new data that comes from the CAS review. There's no new data that's any different to any data that any other country in the world is using to support puberty blockers for gender questioning people. And instead, it's merely looking at the data that's available, and we do feel that it has been biased in such a way that it is against trans people. So a lot of the pro-trans studies have been thrown away for reasons such as the fact that they weren't double-blind studies. That was a big reason that there are arguments that the methodology wasn't clear. But for something like a puberty blocker, you can't have a blind group, you can't have a placebo group, because it's within a year or 2 years or whatever, if you're prepubescent and you're expected to go through puberty, it's really, really obvious to know whether you've been put on a placebo or not, because your puberty would begin or not. So you can't have double-blind trials, really. So it just feels like it was set up, really, the CAS review. It deserves its whole other video, but there's loads of articles about it online there, just about how flawed the CAS review is and how dangerous it is as well, because with the wording of it that's particularly ambiguous in certain points, it could argue maybe that it could well be that people as old as 25 shouldn't be able to transition if they choose so as well, which goes completely against the medical standards of the UK. In the UK, we have something called Gillick consent or Gillick competency, which essentially allows medical practitioners to work with very young people, so people such as ages 14, 15 or whatever, if they can be assessed or seen as obviously being of a sound mind, to be able to choose their own medical treatments. So this is something that's used for really any treatment there, for a patient to be able to consent to the medication that they need to take, or any surgery that needs to be done, things like, well, anything really, there you have to consent to the medication that you're being taken, that you have to take, and proving that you are of sound mental health to be able to have access to that. So it's something that we already have in the UK for numbers of different treatments. And it's just frustrating because now younger trans people are being infantilized and being made out like they're incapable of making these decisions. And the CAS review as well, it doesn't talk very well of people that are neurodiverse. So trans people that could have ADHD or autism or any other symptoms or conditions that are labelled as being on the autistic spectrum. And again, it's really infanticising. It's just trying to say that, they're so precious, they can't consent to their own medical treatment, which is terrible, and it's dangerous too. It's gonna hurt so many lives for an entire generation of trans people, and it's a generation of trans people that are already trying to fight back against this. Right now, there's a protest going on outside of West Streeting's constituency office. I believe it's being organised mainly by Trans Kids Deserve Better, that we talked about in the last video. And these are children, these are transgender children or gender questioning children that are taking matters into their own hands and showing how capable they are by being able to peacefully protest. And somehow we've reached this conclusion there that they're incapable of deciding what medication that they want to use, which again has been used for decades now and is still being used. It's still continuing to be used in the UK for children that have what's called precocious puberty. So puberty that's started too early and needs to be addressed and paused for a few years. So it's not that the medication's inherently dangerous, it's that trans people aren't allowed to access this medication. And the treatment for trans kids in the UK is already a joke. It's already a joke. It's like a 6-year waiting list at this point. So if you come out as trans at 13, then it's nothing to worry about, because you have to go from the Gender Identity Development Service, the waiting list for the children's medical area for trans kids, and you have to grow up to go into the waiting list for the adult services. So it's completely ridiculous that we're even having this conversation. Hilary Cass, as all the criticism that you want to say, she did point out that it's just inadequate for trans people anyway, the NHS, but this shouldn't have happened there. Of all the things that should have been done urgently to save trans lives, to cut down on those years-long waiting lists, or literally anything else to make it more accessible, instead we've banned puberty blockers. So we've completely removed any hope for trans people growing up and having to suffer to have any kind of assistance in the distress that they have. There's already MPs that are hearing horror stories about young trans people in their constituencies who are having their hopes dashed, their only chances of getting the assistance that they truly need. So there was one MP that that I looked into a moment ago called Rachel Taylor. So she's heard recently from a young member of her constituency who's a trans boy. We don't know the exact age or any identifying details, who is now essentially turning to starving themselves so that they don't have to start periods, or to try and stop their breasts from developing, because again, they can't have puberty blockers, they can't have the medication that would actually help them. So this child is now is now having to take matters into their own hands, and they have to do it by hurting themselves, again by starving themselves. So this is going to be an entire generation, as I've been saying, that are going to be in pain, in suffering. The mental health issues for trans kids are already sky high, and they're just going to get higher and higher as the distress gets worse and worse for trans kids, as they think and as they realise that at this moment of time, there just really is no hope. There is just no help for them at this stage until we can get this looked at. And there's been, just going back to what I started with in this clip, there's been no mention of any studies beginning for puberty blockers to actually get some more data there, rather than have someone like Hilary Cass review data which could be criticised for good reasons and bad about this. So there's been no new proposals for studies to be looking into this, and again, it's just completely removing the hope from anyone until this could potentially be reviewed in 2027. It would be that this permanent ban on puberty blockers could be reviewed or looked into. It was reported in September of this year over a few different studies now from the US, where in states where anti-transgender laws have been passed, it has led to humongous spikes in suicide rates for the transgender population, with transgender youths especially, when minors are targeted. So these could be laws in preventing people from using the bathrooms of the gender that they identify as, or again medical care, which we're now suffering from in the UK. And it's led to an increase of suicide rates being as high as 72% it's been. So this really is a dangerous and worrying time for trans people in the UK, and trans youths especially. And the sad thing is, it's not going to stop here, because whilst we're pretty much seeing the full extent of the Cass review now and the dangers that has caused, including some dangers for adults. Again, I think it was a couple of videos back now, we talked about how with certain GICs, like the Chalmers GIC in Scotland, they've been stopping medical referrals, surgery referrals for patients as old as 25, and citing the Cass review, when the Cass review barely even mentioned people that old there. So it really is dangerous times, and there is going to be a review into adult services as well. And I'm sure it will say something nice on the front of it, like, the waiting lists are too high. But I just feel like it's going to say things that are anti-trans to the extent of criticising the access to medication and reducing it more than it already is so hard to get access to this medication. So it really is a worrying time, and do seek help if you need it there. In the description for this video, I'm going to put some helpline numbers for people who are mentally struggling, and do seek help if you do need to access it. But no, I'm just so sorry that this is something that I do need to talk about, but it was something that I needed to get off my chest tonight. Please do leave any comments maybe about how this is making you feel. Do maybe like and share the video as well, and thank you for your time. See ya.